The lack of hormones can make you really tired. And nowadays, you see a lot of young people, guys in their 20s, 21, 22, having hormonal issues. And lots of times the mom, the dad doesn't understand. Hey, you graduated college or you're in college, you slob, go get a job. And dad, you don't understand that that young man does not have that energy and so forth that you had and that his grandpa had, your dad, or and so on and so forth. It's not the same. And so what happens? Lots of times that man, even at a young age, is losing his testosterone. Or women too. Women, you guys have testosterone too. It does the same things, more or less, that it does for a man. Gives you energy, focus, concentration, makes you sleep well, increases sex drive, um, so on and so forth. Okay. Does it have some side effects? Yes. Excessive levels can cause you to have issues with your hair and skin, but that's excessive levels. Okay. And improper supplementation. But now the lack thereof wreaks havoc in your life. And that's not something you want to live with. Now, I know a lot of people say, oh my goodness, supplementing hormones causes cancer and so forth. You can go to Google Scholar. Go to Google Scholar and you'll find more than 3,000 articles talking about the benefits of bioidentical hormone supplementation. Now, you will see that many non-for-profits, okay, many nonprofit organizations don't do research on this or on this specific topic. And I've even seen research on nonprofits talking about bioidentical hormones, how they can be linked to cancer and so forth. But that research is not done properly because those are not fully bioidentical hormones. And I've taken the time to go through a lot of these articles. They're not fully bioidentical hormones. So if you're a health professional out there, I want to invite you not to go to pubmed.gov, right? The NCBI. Don't go there. Or, well, go there too, but go to pubchem.gov. So what's pubchem? That's where the national database of where the pharmacists and so forth and scientists publish all the chemical structures and so forth. And I invite you to put, for example, Provera there, or put Premarin. Hormones, so Premarin is a substitute it's a progestin, right? Which is a substitute for progesterone. But Premarin stands for pregnant mare urine. In case you don't remember what the word mare means, that means horse. So pregnant horse urine. And Pfizer actually has a bunch of horses that they impregnate, and they actually give them Flomax, which is for them to pee, collect that urine, and make the hormones that are given to menopausal women. That's not a good idea. Okay, so when we go to medical school, and I have here some of my old books, and you'll see, for example, this one right here, medical professional, you remember this one, Lippincott Pharmacology, read this whole thing. This is I had to buy a new one because the one in med school is falling apart. And it's funny, I still have here, I'm in my house, so I still have here boarding, a lot of these, see, well, this one's still falling apart, really, well, you can't see it here on the screen, but let me put it closer. Let me move over here. You can see a lot of these my old books all here, scratched up every page of this thing. So still have some of these old ones. This one's a board exam book. I'll keep this one probably for life. But whole point is, when you go through this in med school, they teach you that progestin, that these are progesterone hormones. No, it's not the same thing. Bioidentical means just as your body produces, the hormone that your body produces. When you go to PubChem and you put the name of a lot of these pharmaceutical drugs, and if you're a health professional, I challenge you to go there and look at the structure. Remember organic chemistry? Well, look at the structure of the one your body's producing versus the one that you're prescribing, or the one that you're giving the patients, whatever the patient's taking. You'll see it's not the same. Bioidentical hormones are the hormones your body's producing. And let's think logically. As you're aging, but let's say from a teenager to an adult, as you're adulting, you have a huge surge of hormones. Women, especially estrogen, progesterone, growth hormone, which we'll talk about in a second, testosterone and so forth, and men, especially testosterone in way higher levels. And that's what develops us into adults. And that's, I kind of like to joke around with the guys. I say that's the hustler serum. That's what gets you going every day, etc. Now, when you use hormones that are not bioidentical, that are not exactly like your body's producing, does it cause cancer? Absolutely, it can cause cancer because it's a hormone that's methylated. It's a hormone that has an extra carbon group and your body can attack it. And it goes back to the principle that I always talk about. Your body's designed to consume only things that it knows what it is. Remember, I always talk about a systems approach. Okay, just like an airplane, a car, a company, an orchestra, it's a system. So it's designed to only run on things it knows what it is. I mean, do you guys know one system that you can change up its resources and it'll still run normally? I mean, I've challenged myself with this question multiple times. I don't know. Can you take cooking oil and put it in the gas tank of your car and hope it runs? No. Same thing with us. Can you change a hormone and where your body's like, oh, hey, testosterone, then all of a sudden it's like, you have an extra methyl group here. You're not exactly testosterone, and it fits in the spots. It actually kind of fits in, but then it calls your immune system. And then your immune system starts to, whatever, attack it and so forth. It can lead to autoimmune and a bunch of other issues, right? So the whole point is bioidentical hormones, go to Google Scholar. Don't ever believe a word of what I'm telling you. I'm just here to add some value in your life, give you some ideas for you to become sovereign and for you to study on your own. Don't believe a word I'm saying. Go study on your own. I don't want you to believe me, okay? And especially if you're a health professionals. And my goal, one of my biggest goals, is to influence health professionals. So, maybe we learn how to think different. I'm not trying to get in an argument or fight with anybody. That's not my goal. I'm just saying, hey, how about this hypothesis? And if you're an actual scientific person, one of the things that if you follow the scientific method is to actually look at different hypotheses and put them on the table and weigh them out and not be narrow-minded, right? So everything I'm saying is with all due respect, and it's not to challenge, but to just advocate for innovation and new resources and a new way of thinking. So ultimately, bioidentical hormones, not only have they shown to be safe, but they also are preventative for many, many diseases. Do you know what's the organ that has the most amount of receptors for testosterone in the body? No, it's not your pecker, boys. That's not the organ that has the most amount of receptors for testosterone. It's actually the heart. The heart is the one with the most amount of receptors for testosterone, about 10,000 receptors. Well, does that make any sense? Yeah, I try to make things really simple. What's the heart? The heart is a muscle, right? Does testosterone help muscle? Yes, it does. So if testosterone helps muscle, would it help my heart? Yes, it would. You see what I'm saying? So, whole point is, testosterone can be very beneficial for you, but again, it has to be bioidentical and it has to be dosed properly too. You don't want to go overboard. Remember, the dose is your friend or your enemy, and you want to use it right, and you want to be responsible and stay within proper limits. Obviously, do I use it? Of course I do. I started a bioidentical testosterone supplementation at 30 years old when I had a bunch of health issues and I wasn't feeling well. That was part of my optimization protocol. I mean, I had really bad burnout. I was even put on bioidentical cortisol. And I know that can sound a little funny. I'm not going to discuss that now. We have another lecture on fatigue. Go listen to it there. I talk about bioidentical cortisol supplementation. So now women, when you hit menopause especially, you get the hot flashes and the dryness and just not feeling right, and then the temperature fluctuations, the mood, etc. Listen, women, your best years more than likely were those years between 18 to 31, 32, 33. And then things start to change, your hormones start to decline. Remember, your hormones don't decline and you age. It's the other way around. Your hormones decline and you age. Okay? So now as these hormones start declining, estrogen, progesterone, DHEA, testosterone, growth hormone, you really start to feel a difference. You start to look different. You start to prematurely age. And now if you guys go go on a global cancer map, there's a couple of websites that you can look at a global cancer map by age, statistic, geography, etc. Now, if you look by age, you'll see that the incidence and prevalence, as we say in medicine, is highest. It's highest in the years that you are aging, that you're older, and lower in your younger years. And now, if you look at the hormones, I mean, just think logically. You don't have to be a doctor to figure this out. If you look at the hormones in those younger years, you know they're higher, right? And you tend to have less cancer in those years. So something that I'd love for you guys to really start to understand and inculcate is perhaps hormones are protective for you, right? God designed the hormones. Hormones are inside of you. So the lack of thereof, now let's talk about the other side. The lack of these hormones, can they actually cause problems? Absolutely. Not only on your performance, I mean, exceedingly on your performance, exceedingly in front of the mirror, exceedingly on your day-to-day, but also, are they attracting autoimmune? Are they attracting Alzheimer's? Are they attracting cancers? Are they attracting really strong diseases? Let's talk about Alzheimer's for a second. Alzheimer's is also being dubbed right now diabetes type 3 of the brain, right? Don't take my word for it. Give it a pause. Go to Google Scholar. Just put diabetes type 3 or Alzheimer's diabetes. You'll see this will pop up. So wait a minute. So Alzheimer's, is that a sugar problem? Yeah, there's, it's connected to certain factors like ApoE and etc. But Alzheimer's is in fact a metabolic issue. It's connected to a strong metabolic issue affecting your nervous system. So wait a minute. So diabetes, does it affect my nervous system? Yeah. So people with diabetes, they can get diabetic retinopathy. So it's when your retina starts to suffer because of sugar issues, and you start to lose your vision. It could cause peripheral neuropathies, etc., where you start to have issues in your body because of the nervous, it's called non-enzymatic glycosylation of basement membranes there. That's the medical term. Just lost like half a gallon of saliva to say that. But basically what it's doing, and I always say, the names in medicine sound really complicated, but let me actually break this one down. Non-enzymatic glycosylation, meaning just depositing of sugars. Non-enzymatic means there's no enzymes necessary. Enzymes are these little workers that do things in your body, right? So you don't need these little workers, and they cause deposit of sugars where? In basement membranes. So these membranes, they're found all over the body, so it's depositing sugars there. So if diabetes causes sugar issues, insulin resistance basically, and then there's too much sugar in the blood, causes damages the nervous system via this, I'm not going to repeat the long name, but then where's their highest collection of nervous tissue? Well, I'll be damned. In my brain, right? Or your brain is that, right? So leading to the Alzheimer's. Now let's go back into the hormones. Does testosterone help lower the levels of sugar? Absolutely. It's really good to fight metabolic issues. And what else is another one that really helps sugar? Really, really helps sugar. I always joke around with the guys. I say testosterone is king, but IGF-1 is God. IGF-1, what's IGF-1? Never heard of IGF-1, doc. What the heck's IGF-1? Never heard of this one. My buddies never told me about this one over some beers at the bar. Well, I know you guys talk about testosterone, but IGF-1, I'm a huge fan of IGF-1. So growth hormone, which is made in your pituitary gland, just in the same area where the testosterone is made. Well, testosterone is made in your adrenals and your testicles, sorry, but the signal comes from your pituitary. So imagine my two fingers can meet, boom, that's where your pituitary gland is. Now, the pituitary gland releases LH and FSH, which then go to your testicles and make you produce testosterone, right? So the LH goes to the Leydig cells. It's easy to remember. LH to the Leydig cells. Leydig cells, Leydig cells. That's how I memorized it in medical school. And make the testosterone. And FSH, most guys think it actually makes testosterone. It doesn't. FSH goes to the Sertoli cells and makes the estradiol, right? A little bit of estrogen to help you guys out. We'll talk about the ratios in a second of estrogen and testosterone and so forth. And I'll do probably a proper testosterone protocol, like hacking hormone hacking. You guys got to let me know also what you want. So if you guys could write to us on our Instagram, things like that, and I'll kind of get an idea of what you guys want. So that's definitely, I'll get like really nitty gritty on, you know, proper protocols and ratios and so forth. Today's kind of like more of a bird's eye view on the hormones. But so when you go and look at growth hormone comes from the pituitary as well. Okay. And then, but it doesn't go, obviously, it's not going to go to the testicles. Okay. It's going to go to the liver. Bing. And then the liver produces the IGF-1 that goes all over the body, et cetera, and does a lot of the muscle and burns fat, et cetera. Really good for your spine. People with spinal injury can talk to their doctors about this. And it's really good for metabolic issues, because what does IGF-1 stand for? IGF-1 stands for insulin-like growth factor 1. Wait, you just said insulin-like. Yeah, looks like insulin, but it's not insulin. So you remember when you were a kid, and or maybe you've heard, maybe you're fairly young and you've heard your aunts, uncles, grandma, grandpa, whatever, say, hey, when I was young, I could eat whatever I want and I wouldn't put an ounce of fat on. Why? And now I can't even look at food and I get fat. How many times haven't you heard that? So the reason is because your hormone levels were higher and you were able to metabolize these sugars a lot better, and you didn't suffer so much from these metabolic issues. Now, also something that's happening are us as a general society, our hormone levels are getting lower and lower in younger and younger adults. And that's why you see obesity going up, or diabesity, right? New term, believe, coined by the World Health Organization now. So what happens is when your IGF-1 levels are higher, basically the IGF-1 tells the insulin, hey, buddy, hold on, I'll help you. IGF-1 has about 10% the strength of insulin, so he helps insulin to metabolize these sugars. And, you know, even quite frankly, I hate to give you guys this little hack to eat bad food, but even helps you to metabolize bad food more, I guess, efficiently. But don't do it. Eat healthy, please, really. But I know some guys that want to use this hack to perhaps not eat so healthy, but if you can, try to eat healthy. So whole point is, am I saying that growth hormone is beneficial for your health and IGF-1? Yes, there's a lot of studies showing that growth hormone is beneficial for your health. There's actually a meta-analysis, and there's a link associated to this video, that there's a meta-analysis with around 11,000 participants showing that growth hormone is actually beneficial to not let cancer be present in your life, right? So really important you guys understand this. Do your own research. Again, don't believe a word I'm saying. Speak to your health professional. But it is important to understand that hormones play a huge role in your life. And this is why I keep advocating that we don't get into the nitty-gritty details of medicine. Actually, let's zoom out and think logically. Hold on. I came to this earth with hormones. These hormones are guiding me as I adult. These hormones are guiding me in my feelings, my mood, etc. Do you really think these things inside of your body can cause cancer? For a second, just do you really think? Or is it hormones that are not exactly like the ones your body's producing? So, and ultimately, on the growth hormone, I want to kind of wrap up on the growth hormone. A lot of studies now showing how it's possible to reverse your epigenetic age, or how to live longer. These studies are using recombinant growth hormone therapies to regenerate your thymus gland. And I already did a little segment on the thymus gland. Go see our other electron fatigue. I talk quite a bit about the thymus gland. I'll do a deeper one down the line on just on the thymus gland. I'm obsessed with the thymus gland and the benefits. But recombinant growth hormone is what we use to increase the power of that thymus gland, right? And regenerate the body. So, and it's beneficial for hair, skin, nails, all the beauty stuff. It's the Hollywood hormone, right? You can have your body provoke more hormone, and you can use other peptide agents like CJC 1295, ipamorelin. There's Samorelin, that's kind of old school. I'm not a big fan of it. But some tesamorelin, no longer available in the US. But there's really beneficial, and when I say no longer available in the US, I at least say from FDA regulated compounding pharmacies. So I'll always try to keep you guys updated as it relates to the environment, also the regulatory environment. Remember, regenerative medicine, which is all this that we're talking about, kind of falls under that stem cell environment, et cetera. It's always very, very, very important to understand the regulatory environment in the U.S. in regards to this, and be respectful towards it, and be respectful towards the medical community as we develop and grow and learn to understand these things. And and it's important to see these things with love and understand that where it's a huge, it's a lot of resources to in a big movement to have the whole medical community, let's say, adapt its thinking, because a lot of these books, once they're written, it's really hard to change the mindset and the mind of those who wrote it, unfortunately. And well, a lot of my goal is to create a very peaceful and nice evolution and forward-thinking mind. So in medicine. So as we look at hormones, bioidentical hormones, and like I was mentioning before, women too, as your hormones are declining, you're aging, and the estrogen and progesterone, and lots of times then you go to your doctor and he's giving you, women, like for my mom, for example, she's 60 years old, doing great. My dad's turning 69 this weekend. Also, God bless them, they're doing great. They're on bioidentical hormones. They're on their growth hormone. My mom is on her bioidentical hormones. My wife is on bioidentical hormones. She just had her baby. We're regulating, or her baby, my baby too. I don't know why I said that, but love you, honey. Whole point is, as you guys can do, is I'm freestyling this. It's just speaking the science that's coming from the heart, and then we edit this and just make it pretty for you guys. But I do want you guys to know, this is raw. This is me. This is the science that I can talk about this because there's hours and hours and hours of study, and that's why I can talk about this just off the whim, right? So, and I prefer to do it this way. I'm not a script guy. I'm not I just like to say what comes to mind, and I really hope to add value to you guys. But going back, so these hormones are, with women especially, as they're declining, you will feel it in your life, and you won't feel good. And one thing that I really, really, I think is very interesting when I really like to do this is actually when you show a woman her FSH, LH, estrogen, and progesterone in her blood work, and then you show her different phases that she's in. Okay, because those hormones, um, when you look at the chart, the ovarian cycle, right, and you have that 28-day cycle, and then you have the follicular phase, you have the mid-cycle peak, and you have the luteinizing phase, right? And they're divided in those, like I said, in those 28 days. And you have those four hormones, the FSH and LH, that again, like I mentioned for the men, they connect here at the pituitary gland, okay? Imagine those two fingers are meeting. They produce, your pituitary gland produces the FSH, LH, which goes to the gonads, what are gonads? If you're a man, testicles. If you're a woman, ovaries. So in this case, it goes to the women, right? In the ovaries, and which goes to the granulosa cells and the theca cells, and then it's going to produce the hormones, which is the estrogen and progesterone. Now, when you're premenopausal, you have this beautiful orchestra that lots of times in women is also kind of set off. And many times, you can have PCOS, for example, polycystic ovarian syndrome, and other reasons that it gets set off. Polycystic ovarian syndrome, by definition, is more than 11 retained cysts in the ovary, which unfortunately today the guidelines say you don't have to ultrasound women to, kind of go on symptoms, and technically they usually give the woman birth control, which birth control is maybe not the best idea because again, it's not bioidentical and it can cause some issues. It throws off your micronutrients, zinc, and all these things. But when your body is producing the estrogen and progesterone, right, you feel great. But remember, the orchestra all has to move together, right? Because sometimes one hormone's on day 3, the other hormone's on day 10, your progesterone's over there on day 14, and the estrogen's like acting like as if it's on day 6. It's all off. And then you don't feel right. That's if you're premenopausal, and that's easily adjusted. However, now if you're postmenopausal, I actually think it's the easiest because we don't have to do that orchestra. You just put the woman at her ranges where she should be. You don't need to put her high, too low. I just usually say somewhere around a third to a half of that level of hormone. She's feeling great. She's doing fine. She's doing fantastic, right? Um, so it's important though to understand they need to be bioidentical hormones. Okay, and lots of times, for example, I've seen it with my mom even. Um, I think she does around 1 milligram of bioidentical estrogen with 100 to 150 milligrams of bioidentical progesterone. And she feels really good. And you can see a huge difference in her disposition, mood, energy, focus, concentration, etc. And my dad really thanks me for it. But if this is something not present in her life, you could definitely see a difference. So, and testosterone supplementation in women as well. Testosterone supplementation is super important for the same benefits I said in the man, but also in the women. Helps with energy, mood, etc. The libido. I know sometimes women struggle to find that libido after 30 years married, right? And it's like, oh my goodness, how do I do this? Well, testosterone is your friend. And talk to your healthcare provider about perhaps doing a supplementation. And you can do cream, you can do pellets, you could do injections. I don't usually recommend pellets for a shot because pellets, if you don't know exactly your dose, once the pellets are in, they're kind of hard to get them out, near impossible. So I would consider supplementing with something that you can kind of control with your healthcare provider, say a cream or injectable, and then perhaps consider going on a pellet. But point is, when you do this, and make sure everything in the pellet is bioidentical. Everything has to be bioidentical. When you do this, you start to really live a new life. And even if you're finding yourself fatigued, low energy, etc., you should feel a really strong kicker. Okay, so um, women too, do not forget about the IGF-1. IGF-1 is very important for women as well. You have those levels as well as in your body. So, perhaps speak to your healthcare provider about also checking your IGF-1 levels. You can also, for both men and women, you can actually check a more detailed level of IGF-1, which is IGF-1 BP3. Also a really good marker to look for in the blood. So I can do later a more detailed, just really focus on dosing protocols, etc. In regards to hormone supplementation for men, because there's a whole issue with, are my hormones, I'm taking the testosterone and I'm not feeling it, I'm taking my hormones, I'm not feeling it. Well, the testosterone is tricky both for men and women because there's a molecule called SHBG that steals that hormone, and that causes a little bit of issues there. And then you're free testosterone because you're taking the testosterone, but your free is not truly free. And then you start to feel kind of like wah wah wah. It's not really working. So you need your testosterone to be free, and this a molecule SHBG, which stands for sex hormone binding globulin. You don't want anything stealing sex hormone. Just the name of it sounds terrible. Give me all my sex hormone, right? So there's different agents that you can use to lower the SHBG, natural agents like 10-cod-Ali, which is a plant, or boron, or there's a synthetic agent, which when it's a really bad case, and I happen to have been one of those really bad cases, like really, really bad. I'm one of the worst males I've ever seen with SHBG. And I've seen our group do a little over 3,000 people in total, in males, say half of that. I'm one of the worst. You can use something called danazol, which is a C1 esterase inhibitor. It's actually for people with hereditary angioedema, when their mouth swells up, when they have an immunological reaction to something. But it works really well on this enzyme in the liver and inhibits the liver from producing too much SHBG, which then you're taking the testosterone, but you're not feeling it, right? But like I said, we can do another lecture on the details of hormones and so forth. But what I really wanted you guys to understand today is that whatever you're feeling in your life in regards to maybe low energy, you just feeling the fatigue, not living the life that you want, not focused, memory issues, the lack of hormone causes a lot of brain fog, kind of you're here in the room and then you're in the office, go to the kitchen, it's like, what was I doing here again? So if you find yourself a lot with that, you know, and sometimes, you know, I've seen this plenty of times, you know, Miss Cindy comes in with Harold and she's like, oh my God, Harold's a pain in the butt. You know, he's 80 years old and he's getting lost in the house and he's, you know, nagging me all day. You give him a little bit of bioidentical testosterone cream. They come back about 6 to 8 weeks later. Cindy, how's Harold? Oh my God, he's doing great. Harold, you're so much better. You know, and you know, you ask him, hey, are you finding yourself a little bit better, Mr. Harold? Oh, well, I'll be damned. Yes, I am. And you know, and he, because why? Testosterone helps you with spatial recognition and allows us men to find ourselves even better on a map. It's what makes you hunt. It what makes you hustle. You know, so it's really important to understand that these hormones do play a role in your life. Again, don't take a word that I said as being law or true. Do your own research. Talk to your health providers, but you know, question, be sovereign. Don't accept anything just, hey, they said it, so that's the way it is. Because maybe there's a lot of truth in the opposite direction and there's a better life for you going the other way and understanding that, hey, hold on, maybe hormones are good for me. Maybe they are good for me living a better life. And women, you know, lack of hormones are super connected to osteoporosis, you know, because a lot of people talk about vitamin D, lack of vitamin, and we'll do a separate lecture on bone health. But vitamin D, you know, D3 and K2, you hear that a lot now for bone health, but and it's crucially important. However, you still don't see that DEXA scan, which is the official machine to check on bone health. You don't see much improvement. Well, bioidentical hormones play a huge role. DHEA, estrogen, progesterone. You know how they say grandma fell and broke her hip? No, it's the other way around. Grandma's hip broke and she fell. You were there to see if what happened first? Yeah, well, lots of times that her structural integrity of her skeletal system is not good, and she has the fall, or he has the fall. Happens to men too, and those hormones are necessary. So today I'm just really trying to help you guys to understand how hormones are so important in your life and they need to be bioidentical. Go to PubChem. Go to PubChem to understand the difference in these molecules. And if the molecule's not bioidentical, can it cause cancer? Can it cause problems? Yes, the research shows it can. It can. So listen, I think for today that's it. If you enjoyed today's lecture, let us know. Give us a little comment, give us a little like, subscribe to our channels, write to us. Let us know what your questions are, because I'm gonna continue this work based on the questions that you have. And listen, we're here to serve. We're here to educate you guys and give back. You know what's the best that we can do is educate each other. And I say each other too because I'm always learning medicine and other fields, right? So take this opportunity, and if you watch this until now, very, very grateful. And take this opportunity to motivate yourself to take it to the next level. If you haven't asked that hormone question in your life, well, talk to somebody, talk to a health provider that can help you with that. Understand what hormones are, understand how your body works. It's your body. You only get one. You only get this life to live. I don't know what comes after. I don't know what you believe that comes after, but I particularly believe in another life after this that's going to be a lot better. But for this one right now, this is what you get. So really understand how your body works. Hormones are crucial, and get to it, guys. All right. Love y'all. Dr. D.